Hi, my name is Seth Hosking,
And I'm Nick Eisringer.
and we're doing garlic oil today. So, what is garlic oil? It is a plant from the allium family. It's closely related to onions, shallots, and leeks. It grows in many parts of the world and is a popular ingredient in cooking. It's known by its strong smell and delicious taste. However, throughout ancient history, garlic was used for health and medicinal properties. So the types of things that it's been used for is cancer, antibiotics, high cholesterol, even alcohol-induced liver problems. Today, the effects of garlic are shown to have much less effects, but the links have been made towards heart disease and the following things we just mentioned: blood pressure, cholesterol, and heart rate.
So, what are some of the effects garlic is thought to have? Well, one of the big things Seth talked about, some of its implications it has. Its main mechanism of action is it has a molecule called a linen. And what that does is when you actually chew and break up the garlic cloves, you're releasing a linen metabolite, allicin. And that does is it has an effect on the sulfur hydrogen system, and it plays a role in interacting with that and causing vasodilation of the blood vessels. And that's how it's thought to have worked. As those blood vessels get larger, decreases what the heart has to go through. So it has actually a lot of good effects on blood pressure, cholesterol, and reducing heart disease. So some of the adverse side effects, and some warnings that garlic has been shown to have. Garlic can grow botulism toxin, so you need to at least make sure the cloves and whatnot are cleaned or properly taken care of before you use it. Um, you have to digest this pill. It's taken orally. So again, if you have some type of stomach ulcer or just anything that increases the breakdown of garlic can cause a problem. Can deal with a clotting disorder such as hemophilia. Garlic's been known to interact that way. We'll touch a little farther on that with warfarin. Also, garlic, it's on the safe list of stuff you can ingest during pregnancy. However, it is thought that some of these effects might cross the placenta. So they do really suggest taking garlic only if you need to during pregnancy. It can cross again into the breast milk. So those are some of the small adverse side effects of garlic. Again, don't use it if you're allergic. Can have interactions. I think the bigger implication for our class, what we're going to want to see, is the implication it has with other drugs. So here's just a short list. This isn't comprehensive. Can interact with acetaminophen, so Tylenol, NSAIDs, warfarin, HIV medication, birth control pills. These are just a few. That's not an extensive list, but again, as you can see, garlic has the potential to interfere or interact with a lot of common medications that we'd see in the PT field. So I'd say that's the bigger side effect or take home from the garlic oil.
All right, so just some things that are similar. The side effects, what it interacts with. Some drugs that are similar to garlic are ACE inhibitors. You know, they increase vasodilation, help control your blood pressure, and then it can also be used as just antioxidants in general. And then just the overview, kind of the popular opinion on it. Um, there has been years of uh, documentation of it being used to treat all these different things. Um, it Some of the things I wouldn't recommend it to my little brother when he's going on a date because it's going to give you some bad breath. And another popular thing about garlic is it is one of the main contributors to warding off vampires. That's something that you want to avoid. Um, but overall, the garlic just seems to be it's okay if you want to have a tasty, if you want to add flavor to a meal or something like that.
So to wrap this up, would I recommend this to a family member if they were looking for a tasty snack, like Seth said? Yes. If they had a vampire issue, yes. If they wanted to get rid of a girlfriend with bad breath, yes. However, its medical effects, I would suggest taking something with more research, something that has been more proven if you're dealing with a real health ailment. However, I'm not going to discount garlic. I know that it does have some useful effects. So my advice would be no, I would not recommend this unless there's just something so minor that the side effects and no risk really, it couldn't hurt them. So that's our presentation on garlic oil. I hope you enjoyed.